Bonjour à tous. Content d'être ici ce matin avec les docteurs comme toujours et les ministres Duclos, Anand et Leblanc pour répondre aux questions. Au cours des derniers mois, nos vies ont beaucoup changé. Et pour les jeunes qui sont encore en train d'essayer de trouver leur place dans le monde, ce changement est particulièrement difficile. Earlier this week, I had a chance to speak to high school students at the Ottawa Catholic School Board's virtual academy. We talked about what this pandemic has been like for them, their family, and their friends. And just like young people always do, they had a lot of great questions. One student, Leah, asked how long it would be until we have a vaccine for COVID-19. As I told Leah, we're coming at this from every angle, whether that's investing in Canadian research or securing the world's most promising candidate vaccines. This morning, I want to let Leah and her class know, along with everyone else who's following this, that we're taking yet another step forward. Today, I can announce that we are investing $214 million for Made in Canada vaccines. To begin with, our government is providing up to $173 million for Medicago to advance their vaccine candidate and create a production facility in Quebec City. We have also reached an agreement with them to supply up to 76 million doses of their vaccine. This is about securing potential vaccines for Canadians while supporting good jobs in research. On that note, the second part of today's investment is for the Vancouver-based biotech company Precision Nanosystems. They're also making progress with a vaccine candidate, so we're allocating up to $18.2 million for their development and testing. The final piece of this Made in Canada investment is over $23 million through the Industrial Research Assistance Program for earlier stage vaccine candidates being developed across the country. From Dartmouth to Burnaby, Canadian researchers are doing great work, and we're here to support that. Le savoir-faire canadien est un de nos meilleurs atouts dans la lutte contre ce virus. C'est pourquoi, au mois d'avril, on a investi plus d'1 milliard de dollars dans le plan canadien de mobilisation des sciences afin de lutter contre la COVID-19. Dans le cadre de ce plan, on a investi dans le Fonds stratégique pour l'innovation qui soutient des chercheurs de partout au pays dans l'élaboration et la fabrication de vaccins. Aujourd'hui, on fait un autre pas vers l'avant. Nous allons fournir jusqu'à 173 millions de dollars à l'entreprise Medicago pour faire progresser leur candidat vaccin et pour mettre sur pied une installation de production à Québec. Notre gouvernement a également conclu un accord avec l'entreprise pour obtenir jusqu'à 76 millions de doses de son vaccin. Nous allons aussi investir jusqu'à 18,2 millions de dollars dans le candidat vaccin de l'entreprise Precision Nanosystems établie à Vancouver. Enfin, par l'entremise du programme d'aide à la recherche industrielle, nous allons investir plus de 23 millions de dollars dans d'autres
in other vaccine candidates across the country.
Of course, it's not just Canadian researchers who are working on vaccine options. Around the world, the best and the brightest are coming together to find a solution to this pandemic. Canada has direct agreements with a range of vaccine developers for their most promising candidates. And through our investment in Gavi's COVAX facility and advanced market commitment, we also have access to additional doses for Canadians as part of their international program. When a vaccine is ready, Canada will be too. Alors que la mise au point des vaccins se poursuit, on doit continuer de se servir des outils à notre disposition pour assurer la sécurité des gens. Notre gouvernement travaille sans relâche pour aider les provinces et les territoires à accroître leur capacité de dépistage. Et aujourd'hui, il y a des bonnes nouvelles à vous annoncer là-dessus aussi. Nous venons de recevoir des centaines de milliers de tests de dépistage rapide de l'entreprise Abbott Bio. Et nous les distribuons à l'échelle du pays au moment où on se parle. 2 camions transportant le deuxième test de dépistage rapide conçu par l'entreprise Abbott, ID Now, viennent également d'arriver en Ontario et d'autres suivront sous peu. We now have received hundreds of thousands of the Abbott PanBio rapid tests, which are currently being distributed across the country. 2 trucks of the other Abbott rapid test, ID Now, have also arrived in Ontario, with more coming soon. In the weeks to come, we will continue to support the provinces and territories as we get tests out to the front lines. I want to end today by talking about where we are with this pandemic and where we need to go from here. Yesterday, Canada had the highest ever number of new cases of COVID-19. We have to get these numbers down. This is serious, and everybody must do their part. Your loved ones with pre-existing conditions, your parents, your grandparents, they're counting on you. Our frontline workers, our nurses and doctors, they're counting on you too. People's lives are at stake. We can't afford to be careless or think that this virus will just go away on its own. So please, keep following local public health guidelines. Please wear a mask and keep your distance. And if you haven't already, please join the 4.8 million Canadians who've downloaded the free COVID Alert app. We flattened the curve once before. We beat that first wave and saved lives. I know we can do it again. Hier, on avait 2788 nouveaux cas de COVID-19 au pays. C'est le plus grand nombre qu'on a eu jusqu'à maintenant dans une même journée. On doit réduire la propagation. La vie des gens est en danger. On ne peut pas se permettre d'être insouciant ou de penser que le virus va juste partir de lui-même sans effort. Alors, continuez de suivre les consignes des autorités locales de santé publique. Portez un masque. Gardez vos distances et téléchargez l'application gratuite Alerte COVID. On a réussi à aplatir la courbe ce printemps. Je sais qu'on peut le faire encore cet automne. Merci tout le monde.
Thank you, everyone. I now give the floor to Dr. Tam.
Bonjour à toutes et à tous.
Good morning to everyone.
There have been 209,148 cases of COVID-19 in Canada, including 9,862 deaths. Nationally, there are close to 23,500 active cases across the country. And over the past week, labs across Canada have tested an average of almost 75,000 people daily, with 3.1% testing positive. The average case count is now at 2,488 cases being reported daily in the past 7 days. The number of people experiencing severe illness continued to increase. Over the past 7 days, there were on average just over 1,000 individuals with COVID-19 being treated in Canadian hospitals, including over 200 in critical care, and an average of 23 deaths were reported each day. Last week, Dr. Njoo and I had the honor of speaking at the opening of the Canadian Public Health Association's annual conference, which was held virtually this year. It was an opportunity to reflect on what we have been through collectively over the last 10 months. But most of all, it was an opportunity to thank Canada's public health workforce for their extraordinary work and their commitment, resolve, resiliency, and ingenuity. It is truly inspiring, and I just want to take a moment to acknowledge their efforts today to all Canadians. Canada's public health community has mobilized and collaborated like never before to stand up and sustain this response. We've all had to adapt and adjust as new information emerge, while at the same time navigating through the sea of uncertainties. And yet, the public health workforce has endured and remains steadfast in the commitment to protect and improve the health and resilience of the populations we all feel privileged to serve. But despite public health efforts, no one sector can solve a pandemic alone. Pandemics are whole-of-society events. That means the impacts extend across society, not only by affecting those who become ill, but also by impacting the health, social, and economic systems that affect our overall well-being. It also means that minimizing the pandemic's impact both today and in the future depends on all of our actions now. The longer a pandemic goes on and the less we all do to minimize the related disruptions, the more its impacts will be felt. The public in public health means, as practitioners, we serve the population, but also that the collective actions of the public are a vital part of the power and success of our solutions. We can all do our part by keeping our numbers of in-person close contacts low, and committing to proven effective public health practices. Stay home or self-isolate if you have any symptoms, maintaining physical distance, wear face mask as appropriate, and keep up with hand, cough, and service hygiene. Go the extra mile by downloading the COVID Alert app to break the cycle of infection to help limit the spread of COVID-19. Thank you. Merci.
Bonjour à tous et à toutes.
Good
On a
morning,
signalé
everyone.
209
There have been
148 cas de COVID-19 au Canada,
209,148
dont
cases of COVID-19 in
9
Canada,
décès.
including
À l'échelle nationale,
9,862
il y a près
deaths.
de
Nationally,
23
there are
500
close
cas
to
actifs. Au
23,500
cours de la
active
dernière
cases across
semaine,
the
les
country.
laboratoires
Over
dans
the
tout le
past week,
Canada
labs
ont
across
analysé
Canada have
quotidiennement
tested an
des tests de
average of
dépistage
almost
de presque 75 000
75,000
personnes en
people
moyenne,
daily,
dont
with
3,1%
3.1%
ont reçu
testing
un résultat
positive.
positif. En moyenne, plus de
The average case
2400
count
cas ont été
is now
signalés
at
quotidiennement au cours des 7
2,488
derniers jours.
cases being reported
Le
daily
nombre
over
de
the past
personnes
7
gravement
days.
malades
The number of
continue
people experiencing
d'augmenter.
severe
Au
illness
cours des
continues
7
to
derniers
increase.
jours, une
Over the
moyenne de
past
plus
7
de
days,
1 000
there were on
personnes
average
atteintes
just
de la
over
COVID-19
1,000
étaient
individuals with
soignées dans les
COVID-19
hôpitaux
being treated
canadiens,
in Canadian
dont
hospitals,
plus de 200
including
se
over
trouvaient dans les
200
unités de
in
soins
critical care,
intensifs
and an
et
average of
23 décès étaient
23
signalés
deaths were
en moyenne
reported each
chaque
day.
jour. La semaine dernière,
Last
Dr.
week,
Tam et moi avons eu
Dr.
l'honneur
Tam and
de
I
prendre la
had the
parole
honor of
à
speaking
l'ouverture
at
de
the
la
opening
conférence
of the
annuelle
Canadian
de
Public Health
l'Association canadienne de
Association's
santé
annual
publique
conference,
qui s'est déroulée de
which
façon
was held
virtuelle
virtually this
cette
year.
année. Si nous avons
It
eu
was an
la possibilité
opportunity
de
to
réfléchir
reflect
aux
on
épreuves
what we
que nous
have been
avons
through
traversées
over
au
the
cours des
last
10 derniers
10 months.
mois, c'était avant tout
But most of
l'occasion
all,
de remercier
it was
les
an
effectifs
opportunity to
en
thank
santé
Canada's
publique du
public
Canada
health
de leur
workforce
travail
for their
extraordinaire,
extraordinary work
de leur
and
dévouement,
their
de
commitment,
leur détermination,
resolve,
de leur
resiliency,
résilience et
and
de
ingenuity.
leur ingéniosité. Ces gens sont une
It is
véritable
truly
source d'inspiration
inspiring,
et nous
rather,
tenions
and
à
I
prendre le
just
temps
wanted to take a
aujourd'hui
moment to
de souligner
acknowledge
leurs
their
efforts
efforts
à
today
l'ensemble des
to
Canadiens.
all Canadians.
Le milieu canadien de la santé publique
Canada's
s'est
public health
mobilisé
community
et a
has
collaboré comme
mobilized
jamais
and collaborated like
auparavant
never
pour
before
lutter
to
et
stand up
maintenir
and
notre
sustain
réponse.
this response.
Nous avons tous eu
We've all
à nous
had to adapt
adapter
and
à mesure
adjust
que de nouveaux
as new
renseignements
information
étaient
emerged,
diffusés, tout en
while
nageant
at the
dans
same
une
time
immensité
navigating through the
d'incertitudes.
sea of
Malgré tout,
uncertainties.
les
And
effectifs de
yet,
santé publique
the
ont
public health
enduré les
workforce
épreuves
has
et
endured
demeurent fermement
and remains
résolus
steadfast
à
in the
protéger
commitment to
et à
protect and
améliorer
improve
la
the
santé
health
et la
and resilience
résilience
of
des
the
populations
populations
que
we
nous avons
all
le
feel
privilège
privileged
de
to serve.
servir. Toutefois, malgré les
But
efforts de la
despite
santé
public health's
publique,
efforts,
aucun secteur
no
ne peut à
one
lui seul
sector can
venir à
solve
bout
a
d'une
pandemic
pandémie.
alone.
Une telle crise touche
Pandemics are
l'ensemble de
whole
la
of society
société.
events.
Autrement dit,
That
les
means
répercussions
the
se
impacts
sont fait
extend
sentir partout,
across
non
society,
seulement chez les
not
personnes
only by
malades, mais
affecting those
également
who become
dans
ill,
les systèmes
but
sanitaires,
also by
sociaux
impacting
et
the health,
économiques,
social, and
ce qui
economic systems
répercute sur notre
that affect
bien-être
our
en
overall
général.
well-being.
De plus, la capacité
It
de
also
réduire au
means
minimum
that
les effets de
minimizing
la
the
pandémie
pandemic's
aujourd'hui
impact,
et dans
both
l'avenir
today and in
dépend
the
des gestes que
future,
nous posons
depends
tous
on all of our
maintenant.
actions now.
Plus une pandémie dure
The
longtemps
longer a
et
pandemic
moins
goes on,
nous en
and the
faisons
less
tous
we
pour
all
limiter
do
les
to
perturbations
minimize
qu'elle
the
cause,
related
plus
disruptions,
ces effets
the
se
more
feront
its
sentir.
impacts will be felt.
Dans l'expression santé
The
publique,
public
la
in
notion de
public
public
health means,
renvoie au
as
fait non seulement que
practitioners,
nous servons
we
la
serve the
population en titre de
population,
professionnel,
but also
mais également
that
que les
the
actions
collective
collectives du
actions of
public
the public
sont
are a vital
essentielles
part
et
of the power
l'efficacité
and
et au
success
succès
of our
de nos
solutions.
solutions. Nous pouvons tous
We can
apporter
all
notre
do our part
contribution
by
en
keeping our
limitant nos
number of
contacts étroits
in-person close
et en
contacts
respectant
low
les pratiques
and
de santé
committing to
publique
proven,
efficaces
effective
et
public health
éprouvées.
practices.
Restez à la maison
Stay
et
home,
isolez-vous si vous
self-isolate
avez des
if you
symptômes.
have any
Maintenez
symptoms,
la distanciation
maintain
physique,
physical
portez un
distancing,
masque au besoin,
wear a face
pratiquez
mask
une bonne
as
hygiène des mains
appropriate,
et
and keep up
respectez
with
l'étiquette
hand,
respiratoire
cough, and
et
surface
veillez à
hygiene.
nettoyer et à désinfecter les surfaces. Fait-on un peu plus
Go
et
the extra
téléchargez
mile
l'application
by downloading the COVID Alerts app
à briser
to
le
break the
cycle
cycle of
d'infection
infection
et
to
aider à
help
limiter
limit
la
the spread
propagation
of
de la COVID-19.
COVID-19.
Merci.
Thank you.
Merci beaucoup, Dr. Njoo. Le Premier ministre va
Thank
répondre aux
you
questions pour
very
20
much,
minutes
Dr.
aujourd'hui,
Njoo.
en
The
commençant
Prime
par le
Minister
téléphone.
will
Les ministres et
respond for
docteurs demeureront
questions
disponibles
to
pour répondre à
questions
vos
for
questions par
20
la suite.
minutes.
The
Dr.
Prime Minister
Tam
will be
is
answering questions today for 20 minutes, starting with the phone. Ministers and doctor will remain available for more questions afterwards. Opérateur, on commence par le téléphone, c'est à vous.
operator. We'll start with the phone. You have the floor.
Thank you, merci. First question, Jamie Pashagomskom from APTN, line open. Hi, Mr. Prime Minister. Thanks for my question. My question is for the Niskantaga First Nations. They've been on a boil water advisory for the past 25 years. I was wondering if you're going to be able to stick to your 2015 promise of lifting all water advisories by 2021. I think you said March.
Thank you, Jamie. Since 2015, we have worked incredibly hard to lift long-term boil water advisories across the country in Indigenous communities. We've lifted around 95 of them so far. Many of them had been in place for decades. We recognize there's lots more work to do and numbers more that we need to lift off those long-term advisories. Travel restrictions related to COVID have made it more difficult in certain situations, but we continue to work very closely with communities across the country, with partners. We continue to invest and flow resources so that we can do this. This is a commitment that Canadians expect of this government and one that we expect of ourselves. We will continue to work extremely hard to lift those long-term boil water advisories as soon as possible.
Following up, Jamie.
Yes, thank you. I'm just wondering if you could confirm or not. Are you going to be able to stick to your deadline, or are you going to have to push it back?
As we know, this is a commitment that matters an awful lot to us as a government, but matters even more to Indigenous communities across the country that have gone, in many cases, decades without safe drinking water. We have lifted well over 90 of them so far. Some of them had been in place, indeed, for decades, and we're working extremely quickly to try and resolve all of them. Understandably, COVID-19 and the travel restrictions have come and created challenges in certain communities and certain paths forward, but we continue to be optimistic we're going to be able to lift those remaining boil water advisories soon.
Thank you. Opérateur, prochaine question au téléphone.
Thank you, merci. The next question is from Heather Schofield, Toronto Star, line open.
Good morning, Prime Minister. It's Heather here. I'm wondering, you've expressed concern in the past about a smooth transition of power in the United States, and I'm wondering if last night's debate, which was a bit more traditional in tone, gives you any reason to have a little bit more confidence in the process?
Well, I have always had confidence in Americans' capacity to move forward in a successful way. They've been running elections successfully for a very long time, and we are certainly hopeful that everything will go smoothly, regardless of the outcome in a few weeks. As a government, however, I think Canadians expect for us to prepare for a range of contingencies, and we are, but mostly we are focused on ensuring that regardless of the outcome, regardless of who is president in the coming years, we will be able to continue to stand up for Canadian interests and make sure that Canadians are protected during this COVID-19 pandemic and beyond.
So just to follow up.
Évidemment, notre responsabilité en tant que gouvernement canadien, c'est toujours de s'assurer qu'on est là pour protéger les Canadiens, quels que soient les résultats des élections aux États-Unis. Évidemment, on est en train de regarder ce qui se passe, on est en train de se préparer pour toute éventualité. Mais je suis confiant que nous allons pouvoir continuer d'assurer la sécurité et surtout les intérêts des Canadiens, quel que soit le résultat dans 2 semaines.
result in 2
Following
weeks.
up, Heather.
Yes. Could you just articulate for us what you do see as the Canadian interests in a smooth transition? I mean, it seems, I guess, kind of obvious to all of us. How would you list them?
Well, I think seeing the systems in our largest trading partner continue to function smoothly is of interest to all of us. We've been able to work closely with this administration on many important issues to Canadians. We've stood up for trading relationships. We've defended aluminum and steel workers. We've continued to advance important issues to Canadians both domestically and around the world. And we will continue to work with the United States on that, regardless of what happens in the election coming up. Obviously, as a government, we prepare for multiple contingencies and multiple outcomes and look carefully at the different proposals by potential presidents to make sure that we're able to stand up for Canadian interests. We've done that through sometimes challenging situations over the past years, and we will continue to do that into the future.
Merci. Opérateur, prochaine question téléphone.
Thank you, operator. Next question over the phone.
Thank you, merci. Prochaine question, Catherine Lévesque, La Presse canadienne, à vous.
Question.
Oui, bonjour, Monsieur Trudeau.
Yes,
J'aimerais vous
good afternoon,
entendre
Mr.
sur
Trudeau.
les
I'd like to
commentaires
hear
du
your
président
thoughts
Trump hier,
on
qui
President
disait
Trump's comments
confiant de
yesterday
pouvoir
that said he
distribuer
was
un vaccin
aware of
contre la
distributing
COVID-19
a
la fin de l'année. Je
COVID-19
me demandais, est-ce que c'est votre
vaccine by the end
évaluation
of the
également?
year. Is that also your
Au
assessment?
Canada, nous
In
avons travaillé
Canada,
extrêmement
answer.
fort
In
pour
Canada,
assurer
we have worked very hard
qu'on
to
puisse avoir accès à des
ensure
vaccins
that we can have access
quand on en
to
découvrira
vaccines
où que ce
when
soit dans le monde.
they are
On a signé
discovered
6
around the world.
ententes
We've
avec les
signed 6
différentes compagnies
agreements
à
with a
travers
number
le
of
monde
companies
pour
throughout
des
the world
vaccins, pour des candidats
for
vaccins. Nous avons
candidate
aussi
vaccines.
participé
We
à
have also
l'initiative
participated
COVAX
in the
qui
COVAX
donne
initiative,
des doses au Canada
which gives doses
quand on
in
en achète pour
Canada
le monde
when
en
we
voie de développement
purchase
parce qu'on
for
sait
the
très
developing
bien
world, because we all know
que
very
le
well
Canada ne peut
that
pas s'en
Canada
sortir sans que le monde
cannot
entier s'en sorte
come
de
out of
la
this pandemic
COVID-19.
without the entire world coming out
Nous
of the
sommes,
pandemic.
nous espérons
We
certainement tous qu'un vaccin
that
arrivera bientôt.
a vaccine
Nous sommes déjà en
is
train de travailler
forthcoming.
avec plusieurs de
We
ces
are
compagnies
working
pour
with a number of these
assurer
countries
que
to ensure
nous
that
pouvons garantir aux
we
Canadiens
can
que ce soit
guarantee
sécuritaire.
that it will be
Et
safe
nous
for
sommes
Canadians,
confiants que
and
nous
we
allons
are
pouvoir
confident that
distribuer ces
we will
vaccins de
be able to
façon
distribute
responsable.
this
C'est
vaccine
sûr qu'au début,
responsibly.
on
It's
va
certain
avoir
that in the beginning,
moins de doses
there will
que ce
be
dont on aurait
fewer
besoin pour toute la
doses than we will
population, mais
need for the
au
entire
fur et à
Canadian
mesure
population, but
que l'année prochaine
gradually,
avance, on va
as the
en avoir
year
plus.
progresses, we
Tout
will
est fait
obtain
dans
more.
l'ordre,
Everything will be done in an
mais
orderly
je pense pas que
fashion,
les gens
but I
devraient
don't think that
s'attendre
people should
qu'on ait un
expect
vaccin
there to be a
prêt
vaccine
à être
ready to be
distribué
distributed
bien avant la fin de l'année,
before
si
the end of
même
the year
pas avant le début de
or
2021.
even the beginning of 2021.
We've worked extremely hard with companies around the world to secure Canadian access to vaccines. We know many different companies in different parts of the world are working really hard to try and find and develop a vaccine for COVID-19. Canada has been able to secure agreements with 6 different companies around the world and secure access to further companies through the COVAX facility, which ensures vaccines for Canada, because we're also supporting vaccines for the developing world. These are initiatives that make sure that those vaccines arrive for everywhere, particularly vulnerable countries, when they're most needed, because we can't get out of this until everyone gets out of this. Canada has an excellent portfolio of vaccine potentials, but we also know nobody's got that vaccine yet. There are still trials going on. There are still a number of companies, some closer than others, but we're waiting to ensure that those vaccines are effective and further that they will be safe for Canadians. Nothing will be distributed in Canada until Health Canada is absolutely certain that the safety of Canadians is being properly covered and taken care of. We are hopeful that the vaccines will arrive yesterday, but they won't. There's still a number more months of work to do. I think the reasonable expectations is that vaccines could start to arrive sometime in the new year. But even then, there will be smaller amounts of doses that will have to be distributed to priority populations. I think of our most vulnerable or our frontline workers. And we have experts busy evaluating exactly how and where and in which way to distribute these vaccines. We will, of course, be working closely with provinces and territories to ensure that it's done the right way. We all want to get this COVID-19 crisis behind us as quickly as possible, and that's why we're working on vaccines responsibly, safely, and quickly. But at the same time, Canadians need to know every step of the way their government will continue to be there for them. We will do whatever it takes for as long as it takes to support Canadians while we get through this crisis.
En suivi, Catherine?
Oui, j'aimerais aussi revenir sur les tests rapides qu'on commence à recevoir. Je me demandais comment va s'effectuer la distribution aux provinces. Est-ce que ça se fait au prorata de la population? Puis, est-ce que vous avez trouvé un consensus avec les provinces et les territoires sur qui aura accès à ces
on
tests
who will
rapides
have
en
access to these
priorité?
rapid tests in priority? Is it northern communities or maybe health workers, for
Les
example?
communautés du Nord et éloignées ont
Northern
déjà
and
accès à
remote
un
communities
test
already
rapide. Ça
have
fait des
access
mois
to
qu'on
rapid
utilise un
testing.
test
We've been
rapide
using rapid
dans les
testing there
communautés où
in
les
communities
distances
where
sont très
distances
grandes et les
are
défis sont
large and
énormes
the
en termes
challenges
de
are
dépistage.
enormous in terms of
Mais
testing.
effectivement,
But
nous sommes en
yes,
train de parler avec les provinces
we
et
are
territoires sur la distribution
speaking to the
des
provinces
tests
about the
rapides.
distribution
Ce qui
of
est
rapid
important pour les
testing.
tests
What
rapides,
is
c'est
important to
qu'ils
know
fassent partie
is
d'une
that they are part
stratégie
of
de
a
dépistage
testing
qui a plusieurs
strategy
niveaux.
that has a number
Plusieurs
of
de ces tests
levels.
rapides sont
A number of
un
these
peu moins
rapid tests are
efficaces ou
slightly less
moins
effective or
précis
less
que
precise
les
than
tests actuels
the
qu'on a.
current
Alors,
testing that we
c'est
have.
important de
So it is
pouvoir
important
les
to
utiliser
be able
de
to
façon à
use them
maximiser
to
l'impact sur
maximize their
l'éclosion et le
impact
contrôle de la
on
COVID-19.
outbreaks and
Nous sommes en
control of
conversation, évidemment,
COVID-19. We're
avec,
obviously in
avec nos
conversation
partenaires
with our
provinciaux
partners
et avec les
in the
experts pour
provinces
s'assurer
and
que
with
l'on en
experts
fasse
to
la meilleure
ensure
utilisation,
that we
parce
use
que
them
au
in the
début,
best way
on va
possible,
commencer à en
because in the
recevoir et on
beginning
veut qu'on ait le plus grand impact
we
possible.
want them to have the largest impact
Merci.
possible.
On va maintenant se tourner
Thank
vers les
you. We will
questions dans
now
la salle.
turn to questions in the room.
David Aiken, Global News. Good morning, Prime Minister. It's been exactly 1 month since the throne speech in which your government made some commitments on long-term care facilities, and I wonder if you could update us on where you were at in introducing new criminal code amendments and where you're at in talking to the provinces about new long-term care facility standards.
We have had 20 First Ministers meetings since the beginning of this pandemic, and in my last one, we had a good discussion around sharing best practices across provinces. We've seen that certain areas are having greater success in controlling the spread of COVID-19 in vulnerable populations, like in long-term care facilities. And I think the first step, and one of the advantages of a federation like Canada, is we can learn from each other on how to deal with particular challenges. The federal government recognizes provincial jurisdiction in this area, but we also know that protecting Canadians' lives and dignity is all of our business, and we will continue to work with the provinces to make sure that seniors right across the country feel safe where they live and that family members know that their loved ones are being properly protected.
And if I can just come back to the situation with the Neskatanga, specifically the Neskatanga, not other commitments. In December 2015, your government promised that community that it would build a new treatment plant by 2018. That delay got pushed to March 2019. It's now October 2020. They have a water crisis. Now they've got a confidence crisis that the evacuees in Thunder Bay don't believe you that you will get a water built for that community. Can you talk to them and say what's going on?
Reconciliation is something that is extremely important to this country, and it is a process that will involve many steps forward and a few setbacks. It is difficult, as we all know, to end these long-term boil water advisories. Otherwise, other governments would have done it. We've managed to lift 95 of them, have dozens more to go, and we're continuing to work very closely with all communities involved. I can't share with you exactly the details on this particular community, but I can assure you that Minister Miller and others are working extremely closely with that community in order to resolve this crisis that they're facing right now.
Merci. Prochaine question.
Oui, bonjour, Laurence Martin de Radio-Canada. Juste pour faire le suivi à la question de ma collègue par rapport aux tests rapides, juste pour comprendre, là, quand est-ce que, par exemple, une personne Québec ou à Vancouver va pouvoir avoir ce test rapide-là, précisément? Est-ce qu'on parle de quelques jours, de quelques semaines? Et qu'est-ce que vous répondez à l'opposition qui ne comprend pas en fait pourquoi ça prend autant de temps à mettre en place ce test rapide?
Ça dépend entièrement de la stratégie mise en place
depends entirely on the strategy implemented by the province in question. We have rapid testing. We have more precise testing. The way that the province chooses to use its resources and offer this testing to its inhabitants depends on their situation and their overall testing strategy. Our responsibility as the federal government as it has been since the beginning, is to deliver these tests to the provinces, to ensure that Health Canada approves tests that are safe for Canadians, that to use them to fight against outbreaks and a second wave and other possible future waves of COVID-19. But as far as the strategy for using these tests goes, we are working with the provinces, and they are the ones who have make the ultimate decision.
The access to rapid tests will vary across the country depending on the strategy put forward by the province in question. Rapid tests are one element, have advantages and also disadvantages, and need to be part of a whole strategy on testing, on tracing, on controlling the spread of COVID-19. The federal government's responsibility has been to ensure that these tests get approved and get safe approval and then go to the provinces. We have begun distributing them to provinces, but the provinces will need to determine the best way to use those tests. There are strategies that need to be put in place to balance the needs of certain areas, the various processes available in order to control COVID-19 in the best possible way. And while we work with the provinces and give encouragement and recommendations to the provinces around the best strategies there, ultimately it is the province that will decide how those rapid tests get deployed.
You can go ahead.
Good afternoon, Mr. Prime Minister. Isman Hamidi with the Canadian Press. I want to ask you also about testing. Why should we be confident that this testing plan is as safe for Canadians as quarantining? And why travelers should get priority in testing where there are obviously backlogs in the testing system?
The responsibility of the federal government is to ensure the safety of all Canadians. And I can understand that people would want to have every newfangled solution that they hear about on the internet available to them as quickly as possible. But Health Canada, and I think all Canadians, expect that the work be done to ensure that when we begin to distribute medical services or equipment like tests or eventually vaccines to Canadians, we can be absolutely confident of the safety for Canadians of what we're doing. Yes, we're in a pandemic. Yes, we have to move quickly, but every step of the way, the safety of Canadians will always be paramount. We've moved forward in partnership with provinces on delivering rapid tests, and we'll work with them to develop as they develop the strategies for actually rolling out those tests to maximum impact in the community. As we move forward, we're also seeing, for example, a pilot project in Alberta around business travelers and looking at different quarantine times for people arriving, including airport testing. We're interested in seeing the results of this pilot project, but it is only a pilot project. As we move forward into the coming months and perhaps look at loosening some of the border restrictions internationally, we will be able to have data to rely on to make sure that we are, first and foremost, keeping Canadians safe and controlling the spread of the virus. That will always be our top priority. Nous savons que les gens veulent avoir accès à toutes sortes de technologies et équipements potentiels qu'ils voient sur l'Internet qui pourraient peut-être aider à en finir avec ce virus.
Put an end to this pandemic. But Health Canada and we as a government must ensure that everything we approve, whether they are tests or vaccines, are safe for Canadians. There is nothing more important, and it's a task that we take very seriously. We are happy that we were able to approve rapid tests that are being distributed to the provinces, but we recognize as well that it is up to the provinces to establish the distribution strategies and access to vaccines to draw the maximum benefit from them possible with a restricted number of rapid tests. We will receive more, but we need to maximize their impact from the beginning. At the same time, we will continue to ensure that everything we are doing targets the long term. We just signed a pilot project with Alberta on business travelers being tested immediately and perhaps have a shortened quarantine. It's a very limited project, but it might help us establish further measures at our border. When we eventually decide to remove some restrictions, we'll have data that we can base our decisions on to protect the safety of Canadians at all times.
Glenn McGregor, CTV News. Prime Minister, you've been saying since the spring that aid is coming, some kind of aid package is coming for the airline industry. Wondering how close you are to that now, to aid specific to the airline industry, not general aid to large business, and whether it's going to have any kind of requirements for servicing underserved routes and also compensating passengers who have invested money in airplane tickets and not being able to use them because of the pandemic. Will that be a requirement of any kind of aid for the airline industry?
The details are still very much under discussion and in reflection. We moved right away, as you pointed out, Glenn, to help all industries across this country. And with the wage subsidy, which the airlines and the airline industry certainly made use of, we delivered well over $1 billion in direct aid to the airlines because we know that supporting workers through this pandemic is extremely important. There are certain industries that are harder hit than others because of this pandemic. Travel and tourism is certainly one of them. And that's why we continue to discuss on ways forward to ensure that we're going to have a strong airline industry coming back. But my largest preoccupation is always going to be for Canadians themselves, for workers and for people in rural, remote, or even not so rural or remote regions like Atlantic Canada that are seeing significant reductions in airline service, to make sure that they continue to be well served through this pandemic and after this pandemic. This remains a priority that we continue to work on. Nous avons aidé énormément les travailleurs dans toutes les industries dès le début de cette pandémie avec des mesures comme la subvention salariale.
Like the wage subsidy. For the airline industry, it was over $1 billion that we gave directly to them to help support workers. We recognize that some industries, such as the aeronautics and airline industry, have been struck particularly hard by this pandemic. So we are in continual discussions with them on other potential aid packages. But my major concern and our concern as a government will always be, first and foremost, on assistance for Canadians. That is, for Canadian workers, and also for Canadians who are concerned that during the pandemic or even after the pandemic, they will not have the same air service that they had before. It's a concern for us to ensure regional service, and we will continue to work towards that goal.
Hi, Prime Minister. Tom Perry with CBC. There's a report out just now that the National Chief of the Assembly of First Nations is calling on the head of the RCMP to step down because of her comments about her officers' conduct in Nova Scotia. I'm wondering if you've heard this call from the National Chief, what you think of the RCMP Chief's comments and your response.
The responsibility of the RCMP is to keep Canadians safe. We have seen some challenges in Nova Scotia, not just recently, but over the past many months with the terrible tragedy in how the RCMP has been able to deliver. But at the same time, they continue to serve Canadians day in, day out, right across the country. I've heard concerns from many Canadians about the functioning of our national police force, and we'll continue to listen to Canadians and work with the Chief in terms of the Commissioner, in terms of making sure that we continue to keep Canadians safe. Je sais que
answer repeated in French. I know that what happened recently in Nova Scotia and what happened a number of months ago with the terrible tragedy has raised concerns about the RCMP. We will continue to work to ensure that the RCMP is protecting Canadians and properly serving Canadians. This is a work that I'm doing with the Commissioner, and we are all doing together to ensure that all Canadians are well served by our National Police Force, which continues to keep Canadians safe each and every day.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui.
Thank you very much, Mr. Prime Minister. That's all the time we have today.
On va maintenant retourner au téléphone pour les questions pour les ministres et docteurs. Opérateur, prochaine question.
Next question.
Thank you, merci. Prochaine question, Émilie Bergeron, agence QMI. À vous.
Question.
Oui, bonjour.
Yes, good afternoon.
Peut-être Monsieur Duclos pourra répondre à cette question-là au sujet de l'investissement pour Medicago.
The investment in Medicago.
Il y a été question, Monsieur le Premier ministre a fait mention de l'installation à Québec, une installation de production. Pouvez-vous me donner un peu plus de détails là-dessus?
Can you give us a bit more details on
that?
How many jobs might be created, for example?
Merci beaucoup pour la question.
Thank you very much for the question, and I can tell you that the word that comes to mind is pride. We're very happy that the first Canadian company that could develop a vaccine against COVID is in Quebec City, in the Quebec City region. We are also very proud that this investment supports the biomedical sector and life sciences sector in Quebec City. It is a very robust sector that promises a lot of jobs. There are roughly 9,000 jobs in Quebec City alone that contribute to this biomedical and life sciences sector. So this is great news for health of Canadians in the context of COVID-19, that a Canadian company can so innovatively and rapidly contribute to the development of a vaccine against COVID-19. But it's also great news for vaccine production capacity for the coming years in Canada.
En suivi, Émilie?
Follow-up.
Excusez-moi, est-ce que je peux ajouter quelque chose à cette réponse?
Can I add something to this answer?
Absolument.
Minister Anand says,
je voudrais dire quelque chose au sujet
Thank
de
you. I would like to say something about procurement
et aussi les productions de vaccins.
Vaccine production.
La dernière étape de la chaîne de production du vaccin
vaccine production chain
au Canada,
will be conducted in Canada, like for all agreements on vaccine candidates. We are allowing the developer to determine the production location. But it is a very good news for Quebec and for Canada as well. This investment
dans la recherche
in Canadian research and also in Canadian business. This is the first vaccine candidate which will be produced in Canada, and that is very important for us, for Quebec, and for the entire world. Thank you very much.
En suivi, Émilie?
Follow-up, Émilie?
Oui, sur un autre sujet.
Yes, on another subject. Perhaps Mr. Duclos could also answer this one.
Au sujet de ce contrat accordé à FTI Professional qui a sous-contracté des listes médicales, est-ce que quelqu'un au gouvernement était au courant que ce contrat-là pourrait soulever des questions éthiques et est-ce qu'on était au courant du lien entre FTI et des listes médicales?
And
Écoutez, je pourrais laisser la chance à Mme Anand d'apporter toutes les précisions.
Minister Anand the chance to provide any details on that. I have followed the file. I can assure you that Public Services and Procurement Canada acted appropriately with an open tender, which led to the contribution of 4 different companies to provide artificial respirators and ventilators in an emergency context, and based on recall what the first wave looked like at the end of March.
on faisait face à une concurrence internationale extrêmement difficile et où on faisait face aussi à un possible défi de pénurie d'accès
we were
à
also
des
facing the
ventilateurs et
shortage of
respirateurs
ventilators.
On peut difficilement imaginer ce que ça représente
It would be
d'être sur un
difficult
lit
to
d'hôpital,
imagine being in a
d'avoir besoin d'un
hospital bed
ventilateur
and
et de
needing
ne
a
pas
ventilator
avoir ce
and not
ventilateur
having
parce que
one
les services de santé sont
because
totalement
health
débordés.
services were
Et
completely
ça,
overwhelmed.
c'était un gros
And
problème
that
de
was a
production
real
intérieure. Et quand je laisse ma
domestic
collègue,
production problem.
Madame Anand,
I will allow
ajouter d'autres
Minister
précisions, mais je
Anand
peux vous
to
dire
add
que
further
le
details, but I
contrefactuel
can tell
de ne
you
pas avoir agi
that
rapidement
because
dans ce dossier, mais tout en suivant les processus et
we
les procédures
followed
correctes,
the
le
correct
contrefactuel
process.
aurait pu être terrible.
If we had not acted in the way we did, the result might have been terrible. Minister Anand.
Oui, c'est vrai. Merci, Monsieur.
Yes, it is
Merci
true.
beaucoup, Ministre Duclos.
Thank you very much, Minister
Je voudrais
Duclos.
ajouter
I would like to
les
add
autres détails pour vous,
further
pour
details
soutenir cette
to
accélération.
support this
Innovation,
acceleration.
Sciences et Développement
Innovation in
économique
Science
Canada a lancé au printemps
ESDC launched
une
in
appel
the spring
aux fabricants
a
canadiens
call
afin de
for
les aider à
Canadian
répondre aux
producers to
besoins
help them
croissants
meet
de
the
notre
growing
système
need
de santé.
in our health
Avant
system.
ça,
Before
il y a
that
aucune production
moment, no
de ventilateurs ici
domestic
au Canada.
production
Ça,
of
c'est
ventilators
très important
existed in
de se
Canada,
souvenir.
and that's very important
Nous
to highlight.
devons avoir la
We
production
must
ici
have
en Canada
production here in
ventilateurs
Canada
et
of
aussi pour
ventilators
le
and
EPI.
also
Et
of
ensuite,
personal protective
après
equipment.
l'appel,
And once the call was put
le
out,
comité
the
d'experts,
committee of
comme
experts,
les médecins, aussi
like
les experts
doctors,
en approvisionnement,
procurement
ont
specialists,
choisi des
chose
fournisseurs.
providers.
Et après ce processus,
And after this
nous
process,
avons conclu des contrats
we
avec
signed contracts with a
fournisseurs
number of
de
suppliers
ventilateurs.
of ventilators.
Donc, il y avait un processus
So there was a
et
process.
notre gouvernement a suivi
Our
le
government
processus.
followed
Et
the
ça, c'est la
process.
chose la plus
And
importante
that is the
ici.
most important
Et maintenant,
thing here.
nous
And
avons
now
des ventilateurs
we have
produits
ventilators.
ici
We
au Canada.
produce them here in Canada.
Merci.
Thank you.
Would you like it in English?
Yeah, the Minister Anand would repeat that in English.
Minister Anand, would you like to repeat in English? Yes, Minister. Minister Anand?
Well, you're much better than I am in English, Anita.
Mais pas en français.
But not in French.
I will say that it's extremely important to remember that at the beginning of this pandemic, there was no domestic production of ventilators at all. Our provincial and territorial partners, as well as the Public Health Agency of Canada, were extremely concerned that we needed to have access to ventilators very quickly. And the hard work of my colleague, Minister Baines, and his department at ISED was instrumental in building up domestic production, not only of ventilators, but of PPE across the board. And what ISED did was to launch a call out to Canadian manufacturers in the spring to assist with Canada's response to the growing needs of our healthcare system across the board. Following the receipt of proposals through this call out, and after an expansive review by an expert panel of doctors, of clinicians, of experts in manufacturing and procurement, this expert panel made decisions and selected 4 suppliers. After that process was concluded, then PSPC entered into contracts with those suppliers. Therefore, it's important to remember, first of all, we had no domestic production of ventilators. There was a process established by independent experts. Once that process was concluded, then the government entered into contracts with several suppliers for the domestic production of ventilators. There was a problem with domestic production, and the Government of Canada solved it and will continue to work with Canadian businesses to step up for Canadians and make sure that we have the PPE and we have the other medical supplies like ventilators to keep Canadians safe throughout this entire pandemic and beyond if there happened to be another situation like this that befell our country. Thank you.
Thank you, Minister. We'll take one last question on the phone before returning to the room. Opérateur, c'est à vous.
Thank you, merci. Prochaine question. Hélène Buzetti-Ledevoir, à vous.
Question.
Oui, bonjour.
Yes,
ma question est pour la ministre Anand. Je voudrais savoir concernant les tests rapides. Pourquoi vous avez reçu un premier lot de 100 000 tests rapides? Pourquoi ont-ils été entièrement envoyés en Ontario alors que c'est au Québec que la situation est la pire?
When Quebec has the worst situation right now?
Oui, ça c'est une
Answer.
question très, très importante.
Yes, that is a very important question.
Je voudrais dire
And I would like to say, first of all, that the Government of Canada continues to work with provincial and territorial governments to determine their needs. And
nous travaillons avec l'Agence
we
de
are
santé publique
working
du Canada
with the Public Health Agency of Canada,
qui parle avec les provinces et les territoires chaque jour.
Is in daily contact with the provinces and territories. And it determines where rapid tests must be sent. But I would also like to say that we will receive a lot of rapid tests here in Canada before the end of the year. Over 11 million rapid tests will arrive in Canada. And that is in addition to the traditional testing system, and that's also very important to recall. And I would like to give the floor to Dr. Tam and Dr. Njoo because they represent the Public Health Agency of Canada.
Merci beaucoup. C'est Dr. Njoo. Pour ajouter un peu à ce que le ministre Anand a déjà
Minister Anand already noted
on a déjà discuté, c'est vraiment comme une formule qu'on a négociée avec les provinces et territoires,
a formula that is negotiated with the provinces and territories,
nos homologues,
with our counterparts, and a formula
distribuer les tests de dépistage basés sur la population en général,
based on the population in general, per capita.
80%. Et aussi,
roughly 80%,
on garde aussi 20%.
And we also keep 20%
avec le gouvernement fédéral,
for the federal government,
mesure, parce qu'il y a peut-être une
because there may perhaps be an emergency outbreak or where a province or territory needs more testing for a given situation. That's exactly the situation in Ontario. With what is happening on the ground in Ontario, we decided to send the first batch of rapid tests to Ontario. But it's certain that with, as Minister Anand noted, there will be enough rapid tests for all the provinces and territories.
Well, with all due respect, ministers, you haven't really answered the question. We got 100,000 tests, and it's in Quebec that the situation is worse. Today, Premier Legault is complaining about the fact that he didn't get any tests. So, and Mr. Njoo just said that it was supposed to be a distribution based on population numbers. So, none of this explained to me why Quebec didn't get any of those rapid tests.
Well, I will start by telling you about what I do every day, which is procurement. And I'll speak to the procurement issues and what we've procured, and then I'll ask Dr. Njoo to pick up where I left off. I want to start by saying that we have procured up to nearly 30 million rapid point-of-care tests. 100,000 Abbott ID Now test kits arrived last week and have been delivered, which are the tests that you're referring to. But in addition, we are going to have 2.4 million more ID Now tests to be delivered before the end of the year. More than 200,000 Abbott PanBio test kits arrived this week and are being distributed as we speak directly to provinces and territories, with more on the way. And 8.3 million more PanBio tests will be delivered by the end of the year. So Dr. Njoo a raison, c'est vrai.
Dr. Njoo is right. Yes, we have a lot of tests, and for the provinces and territories as well. But the decisions on where the tests are sent is one that is made by the Public Health Agency of Canada in collaboration with the provinces and territories as well. And on that matter, I would give the floor to Dr. Njoo.
Maybe I can start.
I can just clarify that there has been a arrangement agreement that's already been agreed upon by provinces and territories in terms of per capita allocation of 80% of the supply, together with 20% that is held back in case there's a need for surge capacity. So this is just the first little bit of delivery. And what I was told, I'm not in charge of the distribution and allocation for the rest of the month, for example, but what I've been informed is that every province will get some per capita allocation and that there is an actual mechanism for provinces to request surge capacity should they need it. So this is, you're just seeing the sort of real-time rollout, I think, of the initial delivery, but there will be more as the weeks and days go by in the next while. So I can't speak to the specific timelines for Quebec, but we know that per capita allocation will occur in the next days.
OK. Ce qu'on a déjà constaté, Dr. Tam aussi a souligné, on a déjà une formule pour distribuer les tests de dépistage avec les provinces et territoires. C'est sûr, la base, c'est 80% de tous les dépistages.
80% of testing or of tests will be distributed on a per capita basis, depending on the population of the province and territory. And the government will hold back 20% in reserve to
support en cas d'une urgence, une
address surge capacity or outbreaks.
Se passe actuellement, c'est
les
livraisons. Ça se passe en temps réel. Et c'est sûr que le Québec et toutes les autres provinces et territoires, on entend aussi les autres livraisons des dépistages pour distribuer. Mais avec la première livraison, on a envoyé en Ontario. Et c'est sûr que le Québec va recevoir aussi de leur propre partie
its fair share
nombre de dépistages qu'on va recevoir ici
the rapid
au Canada.
point of care tests that we receive here in Canada.
Dr. Tam, moi, on n'est pas au courant exactement les détails logistiques, mais c'est sûr, on attend les livraisons dans les jours, les semaines suivantes,
more
parce qu'il y a
deliveries in the coming days and weeks because there are millions of tests that will be arriving in Canada.
Je pense que c'est dans les prochains jours et semaines qu'on va recevoir ici au Canada
we will receive them here in Canada and distribute them based upon the formula.
We'll take the last two questions in the room.
Global News. Minister LeBlanc, a question for you. I know you've been sitting there very patiently. Like to have a question, perhaps. You may have heard I asked the Prime Minister about federal-provincial discussions on long-term healthcare standards. I'm not sure I heard a lot of detail there. I wonder if you could add to, is there a work plan? I don't know if it's your department, Minister Haidu's department. Can you give us a little more detail about what work has been done in the last month with the provinces on national long-term care facility standards?
Sure. So as the Prime Minister, I think, properly noted at the 20th First Minister's conversation just a little over a week ago, this was one of the subjects of discussion. A number of premiers indicated to us that they like the idea of beginning by sharing best practices. Different jurisdictions, as the Prime Minister noted, have had some success. Others have had more challenges. Canadians expect, obviously, governments to work together to protect these vulnerable people in the best way possible. I've also started bilateral conversations with some premiers in terms of what would be their priorities if the Government of Canada were to say, how can we partner to improve standards, for example, in your province, or what would be the priorities if the Government of Canada were to say to provinces, we're prepared to help improve. The Prime Minister, I think, has said, used an example of infection control standards. So right across the board, those conversations are taking place. They're taking place, obviously, with my colleague, Minister Haidu, and her counterparts in provinces and territories. but we're having a First Minister's call again in 6 days from now. So I would expect that that subject will be recurring, but we don't wait for those biweekly calls to advance work that we have on an ongoing basis. I spoke to 4 Atlantic premiers this week. My colleague Seamus O'Regan was on the call for a part of the conversation. So it's an ongoing discussion, and obviously we'll continue to do what's necessary to provide the maximum protection that we can to these residents in these vulnerable circumstances.
And Dr. Tam, sort of along the same topic, the Ontario Hospital Commission, or the Ontario Hospital Association, you may have read, testified to that Ontario Commission, that it is worried that rising cases in LTC facilities will put additional pressures on hospital resources, and we now get into canceling of non-elective surgeries and so on. So I wonder if you give me your sense about, are you concerned about mortality rates? Will they be different in long-term care facilities this wave than the first wave? If you give me a sense, maybe any, I don't know if you have any stats, but discussions you might have had with your provincial counterparts on where we stand at this point in terms of the risk to those in long-term care facilities.
I think the highest risk groups in terms of severe illness remains those who are seniors, those who are in the older age groups, and those with underlying medical conditions. And there are also other settings at higher risk, but long-term care facilities, of course, are higher risk settings for sure. And that is that was the picture in the initial wave of the pandemic. So we know that is an absolute area of priority in terms of, the response as the resurgence is occurring right now. So monitoring long-term care facility outbreaks is extremely important. And based on what we have seen, as you can imagine, with increasing number of cases in the community and community transmission, you're going to get more risk of introduction into the long-term care. And so people need to be ready with with screening, with public health measures on an ongoing preventive basis, but immediate testing and rapid testing of those settings as soon as you think you have an outbreak or the initial cases. So that is what the expectation would be with the current guidance provided. What we have seen is that the numbers of long-term care facility outbreaks have increased, including in Quebec and in Ontario. The size of the outbreaks are smaller than in the initial wave. But I'm not sure exactly what that means. That could be people identifying things more rapidly and putting in control measures, and the prevention is better. But you have to watch this space really carefully. And so we can't jump into conclusions at the moment, but it is an important indicator because it will be ahead of the lagging indicators of hospitalizations and, of course, mortality. And so if we're spotting long-term care outbreaks now, it's very likely that increase in numbers of hospitalizations and deaths will follow. So it is an extremely important space to be concerned about. The second issue is the healthcare system capacity. That is another indicator being tracked by provinces and territories, because at a certain point, it does mean canceling of elective surgeries to make room for a potential increase in cases. So again, that's a provincial jurisdiction, but it is one of the indicators that they're tracking as well.
Tam, you heard the Prime Minister being questioned about the evacuation of a First Nations in Northern Ontario because of drinking water problems. This is the second time it's happened in that community. Do you consider this now, the problem there and in other First Nations, to be a public health emergency? And if so, have you spoken to the Prime Minister about this or his Indigenous Services Minister about trying to do something about this, the drinking water situation?
This has been a primary focus of my colleagues in Indigenous Services Canada, so including Dr. Tom Wong, who is their medical advisor. So if you need anything very specific, I would suggest that you speak to Indigenous Services Canada. But as we all know, the impact of the pandemic is not only due directly to COVID-19 itself and the virus that causes it. You have to monitor overall health and health impacts for the populations that we're trying to serve. So you cannot forget, the other risks that may be in different communities. So as much as possible, you're going to have to look at everything in a holistic way. What the Prime Minister sort of highlighted was if there are actual barriers, for example, there's COVID-19 in a community, of course, that could delay other measures. But this is a chronic issue. So what you don't want is an acute on chronic problem where while you're trying to solve the chronic infrastructure and other issues, you could get outbreaks, other outbreaks that could happen. So that has to be watched very carefully. But it is, of course, a public health issue.
Juste une petite question rapide. On en parlait il y a quelques minutes, mais j'ai plusieurs collègues au Québec en ce moment qui se demandent, étant donné que c'est le plus gros foyer d'éclosion, pourquoi est-ce qu'ils n'ont pas eu les tests en premier, les tests rapides?
I don't know the specific logistics to it, but it's something that is transparent and is up to the province to make requests if they need to, but there's a per capita allocation. So I don't know the details of which day something arrives in each province. So that is something that we could get more information on. But it will change day by day because I don't know the delivery dates of each of those. There's different rapid tests as well. But there are mechanisms that are agreed upon by provinces for the allocation. And so that, and if more needs to be requested, there is an actual process you can apply for to get the extra surge capacity. So I don't personally know what Quebec has asked for, so we can get back to people on that, different teams. Yeah.
En français, il y a des mécanismes qui existent actuellement
there are mechanisms that currently exist for a discussion between the federal government and the provinces and territories, and Dr. Tam and I are not really aware of the ins and outs of the logistical discussions, but certainly we could come back with additional information and make that available to you. Thank you.
You always say your decisions are based on science, right? And science, as we all know, always is evolving. What firewalls have you built to make sure that political side can't affect public health experts, and so Canadians can have confidence that science not being co-opted for political reasons?
Well, I think throughout the pandemic, I work very closely with other medical officers of health, and we have established mechanisms to review the science and put out guidance. So that is a key aspect of our job. But there are other expert committees that are also external to the agency, and they have processes in place to make their advice. For example, the upcoming advice for vaccines involves the National Advisory Committee on Immunization, and they make their recommendations. And that's what we have to present to decision makers, recognizing that science is the foundation, but there are many other considerations, be it logistical or otherwise. And so that will be up to the decision makers to take it. It's a complex decision-making process. So we try to the science is evolving, as we just said, and sometimes it's not entirely clear. So that has to be taken into account as the other factors when people make decisions. But we have, long-standing mechanisms. The regulatory authorities I've been emphasizing, we have a regulatory process for reviewing data and clinical trials and established processes for submission. And in the time of an emergency, there are emergency regulatory mechanisms, but does not mean we compromise on safety and on the process of the review. We just have to do it faster and then sort of rolling and ways instead of sequentially. And so that is something that Canadians can count on. We will tell you if we don't know something too. I think that's very important.
Merci beaucoup. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Thank you very much. That marks the end of the press conference.